Early in my career, I took care of a patient whose name was Jack. Jack was a very hardworking, self-employed trucker who, every time I would see him for a complaint, he would tell me he couldn't afford his blood pressure medication or his cholesterol medication, even though he spent more than that on cigarettes every month. One afternoon, the inevitable happened, and Jack had a massive heart attack. He ended up in the emergency room, spent weeks in the hospital, and had multiple cardiac procedures. By the time he returned home from rehab, he was never the same. He couldn't go back to work. He had to remain on disability for the last few years of his life. He died still in his 40s. I wish I could tell you that Jack's story is a unique one, but unfortunately, I think Jack is the poster child of the US healthcare system. We spend about twice as much money on healthcare as most other similar countries to us, and yet in just about every way you can measure quality, our population is sicker and they die sooner, just like Jack. We built this system thinking if we ran healthcare like a business, then free market forces would drive efficiency and increase quality, similar to how it does a household appliance or an automobile. And certainly what we've done by competing for sick patients is we've built up a very robust rescue care system. Our cardiac surgeons are the best in the world. People come from all around for advanced cancer treatments that you can't get anywhere else. Our pharmaceutical industry has great research and development, and I'll add some really cool choreography on their TV commercials. But what this all represents is expensive rescue care. Let me help you think about this a little differently. We don't provide any guarantee of preventive health services to our population. But do you know what we do guarantee access to? The emergency room. If a chronic condition is left alone and not managed correctly, or if a small problem is left alone and gets big, the ultimate destination is ultimately in the emergency room. What people don't keep in mind is it's not just unethical to turn someone away from the emergency room when they need help. It's literally illegal. So whether a patient has been taking good care of their health or not, whether they have insurance or not, whether they are in the United States legally or not, they get the full gamut of rescue health care in the emergency room. And who pays for that cost? Who covered the millions of dollars of care that Jack received in the emergency room when he didn't have health care insurance? All of you did. Because when a healthcare institution is providing millions of dollars of free care, we have to raise the rates on paying customers to compensate. Now, the idea that we spend twice as much money and yet have a sicker population is becoming a little more clear. Let me give you a thought exercise. How much money would the hospital have made if they prevented Jack's heart attack in the first place? $0. How much money does a cardiac surgeon tell a patient if they say, you know what, I don't think you need that surgery? They would make $0. How much does the pharmaceutical industry make if you never develop a condition for which you need their expensive medication? They make $0. Healthcare executives are not evil people, but neither are they stupid. We have developed a system that guarantees payment when people get sick, but there's no incentive to keep people healthy. But that is starting to change. We need to focus on changing the way we pay for health care in order to get better preventive care and reduce the cost of expensive rescue care. For the last 20 years, private insurance companies in the state of Michigan have been paying quality bonuses. So for instance, when I have a group of patients with high blood pressure, if they're all under control by the end of the year, I get a quality bonus. If I take better care of my patients with diabetes, I get a quality bonus. If we get more patients to get their cancer screenings like mammograms and colonoscopies, we get a quality bonus. Our Holland network will get a quality bonus if we keep patients with private insurance out of the emergency room, out of the hospital. We get a quality bonus for that. Another way that healthcare insurances are helping to focus us on prevention instead of on high-cost rescue care is through the use of care managers. All of the primary care offices in this area have care managers that work at them. And when I say primary care, I mean pediatrics and family medicine and internists. So a care manager can sit down with you for a longer period of time than your doctor can explain your health condition and how to manage it, how to dose medications, how to navigate through the complex system that we've set up of multiple specialists. And if you happen to be in the ER, make sure you can afford the medication to keep yourself better. Some of our primary care offices also have pharmacists that work for them. And they will help you go through your multiple medications and understand each one and how to take it correctly. Sometimes they pick up on unintended interactions between medicines that different doctors have prescribed. We have a growing number of mental health providers inside the primary care office because it's so much easier to take care of your physical health when you're starting from a good state of mental health. And these efforts are starting to pay off. Recently, Blue Cross Blue Shield of Michigan has estimated over the 20 years of their quality bonuses and care management services that they have avoided paying for $6.3 billion of healthcare costs, and that's just in the state of Michigan. Another tool we're using to help change the way we pay for healthcare is a shared savings model. This is a renegotiated contract between healthcare providers and insurances that estimates the amount of money that would have been spent on the population we care for, and if we're able to keep them healthy and avoid those unnecessary healthcare costs, the savings that are realized go half to the healthcare providers and half back to the insurance companies. We take the money we earn from these programs to reinvest into the next cycle of prevention. Now, we do have some programs that can help prevent a heart attack and get paid for it. So we have healthier patients, lower insurance costs, and more money into the healthcare industry. Win, win, win. Now, we're having a hard time convincing the people who pay for healthcare insurance to transform the way they pay for healthcare. So politicians and large corporations are still trying to figure this out. But do you know who we have convinced? It's Wall Street. More and more venture capitalists are coming to markets like ours and realizing the investment opportunity of spending millions of their own dollars now for a promise of a share in the savings of care that's never needed when people don't get sick in the first place. This type of effort is bringing new capital into our programs so that we can hire more primary care providers. That's always a problem in areas, especially in rural areas like we live in. We're able to hire analysts to look at our panels of patients and predict who might be at highest risk for an emergency room visit or a hospitalization. Let's surround them with added care to try and prevent that. We now have a kidney dialysis program that tries to address people before they need that very expensive medical service, something that we never could have done before, but we do have that now. We have a growing ability to take care of people in their homes. So if people have advanced illnesses, chronic diseases, have lack of mobility, we can send a team out to their homes and help them there and try and keep them out of the hospital. Other nations that are doing this well, that are paying half as much for better results, are spending about 14% of their healthcare budget on preventive services. In the United States, that number is about 4.7%. So we need to continue to push into prevention so we can lower the healthcare costs for us all. We do still have some barriers. One of these barriers is a high deductible health plan. Maybe many of you have a high deductible plan where you are required to pay thousands of your own dollars ahead of time before the insurance company even kicks in and helps you out. So those programs were designed with good intention. They were trying to help us be better consumers. So I'll choose the generic medication instead of the expensive name brand. Or maybe I'll avoid an unnecessary procedure or test. But the unintended consequences that occur is that people with chronic health conditions or who have a small problem that can be addressed easily are avoiding paying for it because either they don't want to spend the money or they can't spend the money and are instead ending up back in the emergency room. So one of the steps we need to take next is to try and make going to your primary care physician for preventive services and addressing problems when they're small the obvious answer that everyone thinks of. One of the ways we could do this is doing something called a subscription model to primary care, sometimes called direct primary care. And this is where the primary care office gets a monthly stipend to help care for a population in exchange for patients being able to access their primary care without any out-of-pocket costs at any time. There's also another aspect that we started this conversation with. Every other country that I showed you initially guarantees healthcare access to every single person in their community, and we have decided that we're not going to do that. We can't say that we can't afford it. We're already paying twice as much as those countries are for worse outcomes. We have to start thinking like a venture capitalist to understand that it is in our own best interest that we provide healthcare access to everyone so all of our costs will go down. If my patient Jack had had medical insurance and access to my care managers, we could have helped him afford his medications or find out a way to get a hold of them. We might have helped motivate him to stop smoking. Maybe Jack would have never even had a heart attack. By now, he'd probably be retired, hopefully doing the things he loves with the people he loves. And I think we can all agree that that's the best indicator of a successful healthcare system. Thank you.